Is it safe to sleep on the side with a broken humerus?
Hello there. Today, we're going to be discussing a common query many people have following a humerus fracture. Is it safe to sleep on the side with a broken humerus? It's crucial to understand how to best manage your sleep position for comfort and to facilitate healing.
What is the humerus?
The humerus is the bone in your upper arm, extending from the shoulder to the elbow. It plays a vital role in the movement of your arm, and when it's broken, it can cause significant pain and discomfort. Any trauma to this bone should be managed carefully to prevent further complications and promote healing.
How does a broken humerus affect sleep?
Pain and discomfort are often the most significant issues when trying to sleep with a broken humerus. Not only can the fracture itself cause pain, but inflammation and swelling in the area may also make it difficult to find a comfortable position. Furthermore, certain positions might put additional pressure on the fracture site, leading to increased pain and potentially impeding the healing process.
Is it safe to sleep on the side with a broken humerus?
Generally, it's not recommended to sleep on the side with a broken humerus. Doing so can put extra pressure on the fracture site, potentially worsening the injury and causing additional pain. Instead, it's typically advisable to sleep on your back, with your injured arm supported by pillows to alleviate strain and promote proper alignment. Each individual case can vary, so it's important to follow the advice of your healthcare professional.
How to improve sleep comfort with a broken humerus?
Here are some tips to help you sleep better with a broken humerus. 1. Use a pillow to support your arm. This can help to reduce swelling and take pressure off the injured area. 2. Avoid sleeping on the injured side. As mentioned earlier, this can put extra strain on the fracture site. 3. Manage your pain effectively. Over-the-counter pain medication can help, but always consult with your doctor first. 4. Consider a reclining position. Some people find that sleeping in a semi-upright position, such as in a reclining chair, is more comfortable than lying flat. Remember, when dealing with a broken humerus, the top priority should be healing and avoiding further complications. If you're unsure about sleeping positions or any aspect of your care, don't hesitate to reach out to a healthcare professional. We hope that this video has helped you understand more about managing sleep with a broken humerus. Always listen to your body and take good care of yourself during the healing process.